Hello, my name is Gianni, and today I'm going to do a 5-view knee exam. It's going to be, the first view will be AP, the second will be medial oblique, then lateral, and then I'll be doing a tangential patellar view using the Houston method, and then I'll be doing an intercondylar fossa view using the Camp-Coventry method. I'm going to start off with AP, and for most of these, my technique will all be pretty much the same because the knee is very similar in diameter throughout. It'll be 70 at about 4, and then for the patella, I'll change it to about 65 at 4. And I already looked at the order, so I saw that my patient is female and that it's her right knee that's bothering her, but I'll always confirm that with the patient first, and I was sure to grab the pregnancy form to do that before we start taking x-rays on a female. I'm gonna go grab my patient now. I'll be right back. Alrighty, Stephanie, you can take a seat next to that pillow, please. Can you tell me your first and last name?
Stephanie Thomas,
And date of birth?
9/18/95.
All right. And any possibility of pregnancy?
No,
All right. Can you go ahead and just sign this for me, please? Thank you very much, Stephanie. So, Stephanie, which knee is it that's bothering you?
my right knee.
Okay. And did you have a fall, or has it just been aching? What happened?
I did fall.
You fell. I'm sorry. About when was that?
2 weeks ago.
2 weeks ago. Okay. Was there any swelling after that, or did you have any cuts?
Yes.
Okay. To both? Yes, to both?
Yes.
Okay. And have you ever had any knee surgery on the right side?
No.
Any history of cancer?
No.
All right, thank you. That's all the questions I have to ask you right now. I'll have you go ahead and lay on this table for me, please. Belly up. Thank you. All right. I'm going to put this shielding over you. It's a bit heavy. Stephanie, I'm going to roll your pant leg up if that's okay.
Yes.
I'm going to raise you up first, though. So I'm going to start with AP view. My central ray is aligned with the bucky, and I'm going to make sure that I am detented at 40 inches. All right. So I would like there not to be any linens or her pant leg over, so I'm just going to roll her pant legs up. Thank you, Stephanie. You can go ahead and rest your foot down. Make sure that your foot is nice and parallel. Perfect. And I want my central ray to enter a 1/2 inch inferior to the patellar apex. So I'm only going to move my table now that I've aligned my bucky. I'm going to feel for that. All right. I'm going to feel for that apex. There we go. And it's her right knee, so I always want to put my right marker on the lateral edge of that image. All right, Stephanie, stay just like that, nice and still, please. And I'm using 70 kV at 4 mass. And also, if I have a larger patient, I would want to use 3 degrees to 5 degrees cephalic. And if my patient was just average size, I would use no tube angle, and then I would do 3 degrees to 5 degrees. I would do 3 to 5 degrees cotted if my patient was smaller, like a child, or a very, very skinny older person. All right, I'm going to do x-ray. Great. All right, thank you, Stephanie. So for the next one, I'll have you rotate your whole leg in towards, like you're gonna, perfect, just like that. Just like that for me, thank you. And my central ray is going to again enter at the apex, at the 1/2 inch inferior to the apex of the patella. And I'm only moving my table because my central ray is aligned. Right. And Stephanie, can I have you scooch a little bit to your left, please? That's great. Oh, back towards me a little, I'm sorry. That's good. That's good. Just like that. I'm just going to move a little bit. And then rotate inward again. Perfect. And And then I'll use 70 kV at 4 degrees for mass for this one as well. Stay just like that, Stephanie. Woo. All right, so now we will do the lateral. Okay, Stephanie, so for the lateral, I'll have you turn on your right side and face me. Are you good? Want me to double pillow for you?
I do.
You can do it, okay.
Thank you.
Of course. Okay, Stephanie, so I'm going to put this over you still. And then can you move your left leg behind your right to kind of hold you up? Perfect. Just like that. So I want to make sure that my central ray is 1 inch distal to the medial epicondyles. Right here. We'll feel for those medial epicondyles are palpable, and then we'll just go about 1 inch distal to those. And also I want to make sure that her knee is flexed between 20 and 30 degrees. And I'm going to angle this between 5 and 7 degrees. Alright, so because I angled that, I'm going to need to make sure this is nice and lined up again. And it is. I'm going to still use 70 at 4, and I'm going to put my marker, my right marker on. Stephanie, stay just like that for me, please. Sorry, is this falling off you? Oh, sorry. Woo-hoo. All right, Stephanie, thank you. So I did all of my views in the table bucky. Now I'm going to take this on out, and the next views are going to be tabletop. So I'm going to start with the familiarly called sunrise view, but it is the tangential patella, and then I'm using the Houston method. So I'm going to angle my tube about 45 degrees cephalad. And for this, my kV is going to be 65 and my mass is still going to be 4. Here I want my central ray to enter at the patellar femoral joint. Stephanie, can I have you lay on your belly, please? Thank you. All right, Stephanie, can you bend your right knee up for me, please? Thank you. And then again, I want to make sure that this is lined up. Oh, nope, I don't need to line it up because I'm putting this under her. Stephanie, can you raise your leg up for me, please? That's perfect, just like that is great. Okay, relax. So I really can hone down on this because I'm only getting that little patella, that small sesamoid bone. And I still want an SID of about 40. Stephanie, just like that is great. Thank you. And I'm going to remember my marker. Time the x-ray. Okay, Stephanie, relax your foot down. So for my next one, my tube's going to be angled 40 degrees cotton. And for my central ray is going to enter at the intercondylar fossa, at the popliteal region of the knee. So that's just the back section of the knee. Stephanie, can you raise your leg up for me, please? I'm just going to scoot this out a little bit. Thank you, that's great, just like that. You can rest it down again for me. I'm putting my right marker down again. I'll have you keep your leg just like that. Sometimes you might have to put a pillow or a sponge behind the patient's leg, but since Stephanie didn't have any serious trauma and seems like she's comfortable holding it like this, I'll just do it like this for now. Right, central ray right in that popliteal region. And for this one, I'm going to use about 70 kV at 4 mass, same as the first couple images I was taking. Hold it just like that, Stephanie. All right, you can relax your leg down, Stephanie. Thank you so much. Okay, I'll take this heavy shield off of you, and when you're ready, you can roll over to the other side. And I won't have you hop off the table quite yet. I'll lower it down for you. Thank you so much, Stephanie. Hope you have a great day. Hope your knee starts feeling better soon.
Thank you.
You're welcome. No more falling. Thank you. And that is how you do a 5-view complete knee series. Thank you for watching.